Sleep is essential for good overall health. Our bodies need that time to rest, reset, and repair. Studies have shown that inadequate sleep can cause memory problems, have negative effects on heart health, and even cause weight gain. Do others complain about your snoring? Do you wake up during the night gasping for air? Are you always tired during the day? Do you suffer from frequent headaches? You may hear people say if you snore, you have sleep apnea. This generalization is simply not true. It is common for people to snore when they have allergies or a cold. Snoring is a sign of obstructed breathing and can be a sign of sleep apnea, but it is not the only symptom. Some of the most common signs and symptoms of sleep apnea include chronic snoring, difficulty sleeping or breathing at night, choking or gasping for air, frequent urination during the night, poor sleep quality, morning headaches, daytime sleepiness, mouth breathing, excessive sweating during the night, and weight gain. Some adults with sleep apnea have an enlarged uvula or soft palate. Others have excess weight around the neck or a narrow airway. The soft tissues of the mouth and throat become too relaxed, which is an involuntary phenomenon among sleep apnea sufferers. Sleep apnea can also be exacerbated with habits like drinking, smoking, or using sedatives. When these things occur together or separately, an obstruction can occur, restricting airflow and oxygen to the brain. Sleep apnea results in low blood oxygen levels, increasing your risk for serious health problems and a slow deterioration of the immune system. Sleep apnea sufferers are 23 times more likely to have a heart attack, 3 times more likely to have a stroke, more likely to overeat due to hormonal changes, 3 times more likely to develop diabetes caused by insulin resistance, at a greater risk of falling asleep at the wheel, more prone to fracture and break teeth due to teeth grinding, and more likely to suffer from TMJ. So how is sleep apnea treated? CPAP stands for Continuous Positive Airway Pressure, which is applied through a machine hooked up to a face mask during sleep. CPAP machines can provide very effective treatment of sleep apnea, but not every user can tolerate the machine and may have a difficult time wearing a bulky mask all night. Thankfully, your dentist has another solution. You can be fitted with a custom device or oral appliance that is molded to your individual teeth and bite and shifts the jaw slightly forward. This opens the obstructed airway to allow better breathing quality during the night. Oral appliance therapy is more portable, more convenient, and may be more cost-effective. Family history is very important in the diagnosis of sleep apnea. Children with sleep apnea may have enlarged tonsils. In fact, doctors may only need to do a visual exam and review a child's medical history to make the diagnosis of sleep apnea in a child. If you think your child has sleep apnea, be sure and tell your doctor about your family history and all your child's signs and symptoms. If you suspect you have sleep apnea, have already been diagnosed but have reservations about the CPAP, or have already been unsuccessful with CPAP therapy, make an appointment with your dentist today to see if we can help you sleep better tonight for a healthier tomorrow.